Hi, I'd like to talk about some ways you can help your back at home. Here are some at-home tips to reduce your back pain. Hi, I'm Dr. Linn. The problem with low back pain is that there is a lot of increased pressure in your disc that's called intradiscal pressure. This pressure pinches nerves and does not allow fluids, oxygen, and blood to enter the disc because of that pressure that's pushing it away, and it won't allow for healing. Therefore, we need to do things that will reduce the intradiscal pressures. There are certain activities of daily living that should be done or avoided so we can decrease the pressure on our back and discs. Rule number one: if you suffer from an acute back injury or you have a sudden onset of back pain, please be sure to apply ice to the area at least for 2 to 3 days every couple of hours. The best way to make ice packs is to get some small kitchen towels, fold them up in quarters, get them wet, and then put them in a large plastic baggie and stick them in the freezer. You will want to make 3 to 4 of these packs so you have them ready at your convenience. A big mistake people make when they have back pain or pain in general is to apply heat because it feels good. This is probably the worst thing you can do because this drives inflammation, which drives pain, and that makes a whole lot of swelling. So remember, injury new, make it nice with ice. Injury old, make it neat with heat. Rule number two: sitting increases disc pressure 11 times more than standing. So you must avoid prolonged sitting. And when you do sit, make sure you're in a good chair with proper support. A good rule of thumb is to not sit longer than 15 to 20 minutes at a time. Get up, walk around, stretch out. Rule number three: if your pain is severe, you'll need to lie flat on your back with a couple of pillows propped up under behind your knees. This will have a good effect on decreasing that pressure. Rule number four: you must avoid bending at the waist. And a combination of bending and twisting is really bad. So the combination of bending at the waist and twisting at the same time is very injurious to your low back. Be sure to bend your knees if you're going to lift objects, even if it's a pen. And always remember that lifting is always hazardous, and be sure to get help if something's too heavy for you. Rule number 5. When you have back pain, do not sleep on your stomach. This only creates more pressure on your facet joints in your low back and your disc. Try to sleep on your side with your legs and knees bent, or on your back with a couple of pillows propped up behind your knees. If your pain is lasting more than 2 weeks and is not improving, it's probably time to get an evaluation to see if you may be suffering from a more serious condition. Please call our office at 708-574-4018 for a free consultation and evaluation of your back pain. You can also visit us on the web to see success stories of other patients at oaklawnwellness.com. If you have any questions, email me at healthquest9443 at gmail.com, and I thank you for listening.